The increasing cases of maternal deaths in the Sissala enclave in time past has been attributed to inadequate emergency services in the area. Residents often struggle to transport seriously sick persons or women who are in labor at outlandish communities to hospitals on time for medical attention, sometimes resulting in their deaths. Country Director for Virtue Foundation, Mohamed Issa Batagale, recounted one of many instances that he has to yield to pleas from stranded family members of women who are in labor to transport them with his car to the Tumu Municipal Hospital.
There was a young lady in labor that had been attended to by a traditional birth attendant, and unfortunately she couldn't deliver. She became weak and couldn't even sit on a normal motorbike. So I was pleased to give her some support to the main hospital. Bringing her to my car, I saw a very weak and frail young lady. The lady accompanying her was actually even saying out of frustration that the mother passed to eternity because of this. And I said that, okay, then why don't we try to get her to the hospital? Out of fear, we sped actually. And upon reaching one community, we ran into a speed ramp and she delivered in my car. Rushing her to the hospital, I took a picture of her and then sent to my bosses back in the state, indicating the plight of the rural woman. In an attempt to give life, most of them lose their lives. What can we do to help? And it is based on that we improvised 2 tricycle ambulances, one stationed in Bugubale, another one stationed in Bano. It is based on that we are able to raise some data. Then we felt the need to invite a group that are focused on health emergency transport system.
Worried about the incident, he quickly connected with Moving Health, a non-governmental organization that has a mixture of social health workers and engineers who come together to fabricate affordable emergency transportation for rural areas in the country. Moving Health has been in the Sissala enclave since 2019 and provided the first tricycle ambulances in 2021 to 5 communities on a pilot base. Some concerns were however raised in the usage of the tricycle ambulance by the residents in a feedback and data collected by Moving Health and presented by its development lead, Stephen Majo.
So one thing we know is that delay in accessing emergency healthcare transportation is one of the reasons why we have some mortality cases, and this is one thing that Moving Health is trying to solve, the ease in trying to access emergency transportation. So when we asked people how they felt when they used these motorcycles to get to the health center, most of them said these were like the top 5 things that people said. They felt uncomfortable when they were on the motorcycle. They felt unsafe. They were worried. They were in pain. They were stressed and they were tired. And for Moving Health, we want to make sure that the emergency transportation we provide is very comfortable, it's affordable, and it's also accessible to everyone, irrespective of your socioeconomic status. We want you to be able to access this ambulance and for you to get the healthcare that you need when you need it.
At a program to relaunch the tricycle ambulance, otherwise known as the Sissala East Tricycle, Chief Executive Officer of Moving Health, Isaac Amor Kwanzaa, noted that the feedback and data got from the communities are incorporated into the new designs of the new ambulances.
The feedback that we had was about the space in the first ambulance that we made. So this time around, this ambulance is spacious. It's having like a retractable stretcher that you can just remove in and out of the ambulance easily. Then it's having a lot of ventilation and the lighting system. So the lighting system is key because sometimes when they are on the way transporting a patient, sometimes they have to attend to the patient and they need lights to attend to the patient. So that's why we made those new changes, and we made the body in such a way that it's having a lot of thermal characteristics. Heat does not get in easily because you know the northern part of Ghana is very hot, and you have to make something which is robust from get-go. It should be dust proof. So if you see this ambulance, the body is very hard body because we made it in such a way that it will withstand the condition of the northern sector of Ghana.
Apart from the reduction in maternal deaths in the area, employment is also created for the people to lift them from the poverty quagmire they are wallowing in.
We also use this as a way of transferring engineering language. So you can see this ambulances parked behind me. They are not made from people outside the region. They are all made by Sissala people. All the engineers are from Sissala land. And through that way, we're able to empower the locals to solve their own problems that surround them.
Co-founder of Moving Health and one of the lead engineers for the manufacturing of the ambulances, Emily Young, is happy with their association with the project.
We're very, very excited about this design. It's very robust, it can handle the terrain, the interior of the ambulance is spacious, it's very functional, and throughout the entire design you can see these little components that we've added that are from direct pieces of feedback from various members of the communities. We always, as engineers, want to keep on improving, so the next version of these ambulances we're already working on. We're very excited about what's to come in the future, but right now we're extremely proud and excited about this ambulance. 5
communities located in outlandish communities in the Sissala East municipality are the first beneficiaries of the newly designed ambulances.
So for now, we are dealing with 5 communities currently: Barosibele, Nablo, Kong, Sakai, and Nabugubele. But soon we are expanding to 5 other communities, and in June we have a partnership with another organization called KGO, and we will be launching soon in Sissala East as well.
Despite the fee chalked, Emily Young is not oblivious of the challenges encountered right at the start.
It's taken a long time for us to get here. The local manufacturing process, we've been doing a lot of research and development into the right materials, where are we supplying them from, what are the fabrication processes, what are the manufacturing techniques that we want to use, what do we need to do to make sure that these ambulances can be made in Ghana and be made in Sissala land and have those suppliers that are reliable, that are based in Ghana. So it's been a very long journey for us to get here. As Isaac mentioned in our program.
Also present at the function was the Upper Regional Coordinator of the Northern Development Authority, NDA, Maria Johanna.
NDA, where I work with, happen to have had some of these tricycles very recently, 23 of them in the region, and they look very similar. But I would say that the ones I see here, they look very robust, and there are some equipment they have put in which the one that NDA provided do not have. We already have been in talks with Moving Health to learn together, collaborate together to see how we can use these ambulances to improve health, not just in Sissala East, but in all districts in the Upper West region and in the Northern Zone as a whole.
Moving Health also used the opportunity to donate fridges and a desktop computer to the National Ambulance and the Ghana National Fire Services to aid in their work. Reporting for Joy News, Rafik Salam, Tumu.